it is Essential back. I am so excited to be back apart from like 20 million things that is going on. But as you guys know, throughout this video for today, it's going to be basically about dealing with chronic pain. Now, I did make a very short IGTV video about this on my Instagram. You should go follow me. It'll be under my description. But in this video, I will be speaking about my personal experience with chronic pain, and then I will tell you a little bit on how I try to deal with it. So if you haven't done so already, guys, and you don't know me, definitely follow my channel and subscribe right down below. Make sure to turn on that notification bell so that way YouTube lets you know when I first post a video if you do end up liking me. Sorry, I'm fixing my hair and I'll tell you why I have this in 2 seconds. But definitely also like this video at the end if you do like it as well. YouTube, it will let YouTube know whether my channel is being liked or not. So that'll definitely help out. So let's continue. So honestly, there's two things that have recently happened on where you guys might have saw very quickly that I'm like handicapped on both hands for different reasons. So I'm just going to talk about that first. So I recently made appointments. I think I spoke about it in my migraine and headache video on I had to visit a physical therapist and occupational therapist. So obviously two different things, but mainly it's dealing with my chronic body pain, which is mostly like the back, the knees, the hands, you know, stuff like that. So it was very important for me to actually adjust and get that over with. So I ended up seeing my occupational therapist today, which kind of deals with my hands and my wrists on where I do have the most problems. And in regards to those problems is basically we're still trying to figure out whether I have carpal tunnel syndrome. So it's basically when a nerves in your medial hand kind of inflame up, and you know, obviously it bothers you, it's an inflamed nerve. And we're not 100% sure whether it is carpal tunnel, considering I have to still do an EMG exam. So I'm hoping that that will kind of help me out a little bit. And that is the reason why I have this on, because this kind of helps, you know, my wrists kind of elevate and to minimize me from doing a lot of movement in it, just because, you know, any single movement that you do is gonna bother, it's gonna hurt. So that's like my main like big thing, and especially like when I sleep, because I don't know if I actually do this because I haven't witnessed myself doing it, but I think it may be possible that I am unintentionally bending my wrists or my hands or sleeping on my hand, or, you know, it adds on to the pain that I already have. So having this actually does help, and it has the hard metal part here, so it just keeps your wrists and it keeps your hands at like a specific motion where you're not intended to use it as much. So I think that that is one important thing that I would have to say about wearing a brace. I do have another brace. I don't know where it is at the moment, but it looks just like this. But the only difference with that brace is that it has an extender to the thumb, and it keeps my thumb very still. But speaking with my therapist, he said that I don't really need like my thumb pretty much extended. It's mostly the palm of the hand. So I said, all right. So then that's why he gave me this one, because it's going to be much easier for me to have finger motion. But going with the other problem that I have that you guys probably saw is this, which is basically a splint that he made me. Now, the reason why I have this is because I don't remember, maybe I showed you guys, maybe I didn't. I do have a deformed finger. So the problem with the deformed finger is that it bothers me. It's very uncomfortable. And it is on my dominant hand. I'm right-handed. So the fact that it's on my dominant hands, the joint that I have in the middle, well, I'll show you. The joint that I have in the middle of the finger, so your joints here, mine is sticking out more to the other side, which kind of makes it, I guess, lean against my index finger. And my index finger is where, you know, I get the most pain because I'm typing. So I'll show you guys in 2 seconds. So I do have a deformed finger. Now, by you guys looking, it's actually 2 fingers, but my middle finger is worse than the other one. So I don't know if you guys can see, but it's this finger. It leans more this way, like whoop, and I'll show you in this actually this view is much better. So it basically goes this way, and that's the reason why, because I'm always writing. So this joint here, it like hits against this, and it's painful because I'm always, I'm always on my hand, I'm always writing, so it's painful. So he made this for me, and he made it so that way my finger leans a little bit more, I guess, to the other side. So that way it's not tempted to kind of lean towards the other side. So that way it can give that joint a rest, because it could be that the pain is coming from inflammation. So it may be that my joint is swollen, and that's why it always hurts when I write, or it just bothers, or it tingles, or it's numb. So there's different reasons why it could make it worse. But, it's just, it has its separate reasons, so it's just like whatever at this point. But I literally had this conversation with my occupational therapist. And it's so funny because at some point you develop a relationship with all your doctors and stuff. And I just thought it was so funny because I just had to make jokes out of it. I was like, well, I guess I'm going to be handicapped from both hands if I decide to corner myself. And he just starts laughing because, what else can you do? I like to make my doctors laugh. That's just how I am. I can't sit there and not have a type of humor just because I don't want to sit there and be sad. So I rather bring up the humor. And the good part is that, I haven't saw my physical therapist yet. I will be seeing her, I think, tomorrow. Yeah, I think I'll be seeing her tomorrow, so I'm going to be fluctuating back and forth. I'm going to try. I don't know if I'll be able to, but I'm going to try and film the process as much as possible, because I feel that there's not much awareness for physical therapy, because sometimes, especially when it is the hands, I've always had issues with my hands. I actually did physical therapy in my hands 2 years ago, but it doesn't do anything, so I had to stop. So I have to start all over again with a new doctor and try and, fluctuate from there. But what was I saying? But yeah, fluctuating back and forth with both doctors, it's important for me to get both done. So I'm hoping that this time I can actually find the right treatment and, just hopefully like get everything done, because, like I said, I advocate for all women who go through chronic pain. It is not easy. And this is not just because I have a condition, because yes, my condition does not make the situation any better, but there is a specific chronic pain condition where it's just, you just have pain, and sometimes you don't know where it comes from. You don't know why, and every single body part that you have pain in is a specific doctor. So it's annoying when you do try and find treatment to kind of get every body part done. Like I said, I have to see 2 different types of therapists because they both do different things for every part of my body that I'm having pain in, which is all physical. So at this point, it's like, really, guys, like, really? But I know that's a lot. It's a lot to take in, not only for me, but for many of you who are probably watching me right now. Yes, it's a lot to take in. But, keeping a positive mind throughout the whole thing is what's going to help you, lower your chronic pain mentally, because chronic pain can also be mental. You try to make the best out of it, and I think that's important. So, don't worry, I always smile, I always go throughout my day, and that's what's important to me. Like I said, I go to the office and I make my doctors laugh. So that's just the key to my happiness. But, advocating for the chronic pain, it's not easy. Many thousands of people, millions of people go through it. And there isn't a set treatment on how you handle stuff. It's trial and error. Just like my condition, it's trial and error, and you have to see what works for you, see, what type of therapy or what type of workouts you can do to eliminate it. So I guess this is my start for me. So besides that, before I did all of this, there are a few things that I've done for chronic pain that I would like to mention. Not a big deal, but it goes back and forth. So you try as best as you can, but a couple of them has to be hot showers, the Elemis musculoskeletal oil or any muscle oil, and tea. Tea is so good for you. Sorry guys, I literally had to stop the video because one of my doctor's office called me. The life, I'm telling you, my doctors call me more than my friends do. Like, you can't make this shit up. But anyway, going forward, I forgot where I was, but just to get back into the topic. Oh yeah. So I was in the 3 things that I do to deal with chronic pain. One, I did mention it was tea. The reason why I say tea is a helpful remedy for my chronic pain is because tea is hot. For some reason, drinking like hot tea for me, like whether it's black tea or peppermint or chamomile, for some reason it doesn't fix it, but it calms me down. And when it calms down my nerves, for some reason, it just makes me feel like a little bit numb, not in a bad way, but numb like in a good way, where I just feel like I'm like shaggy still, like, and you know, it kind of takes a little bit of the pain away. This is me not involving any type of oral medication. So that's one of the things that I do. The hot shower, number 2, is so important to me because I love taking hot showers, and I mean hot. Like, I'm one of those type of people that can take a shower all the way to the maximum level and I feel no pain. So, you know, it's just crazy, you know, and I try. I really do try, but the hot shower is the best feeling ever, and it calms every single nerve and muscle in my body. And unfortunately, it's only a temporary fix. Like, it doesn't relieve your chronic pain, maybe not for the entire day, maybe not for the entire week, but temporarily it does really do good for me, and I love it. I mean, clearly I can't take 30 showers a day hot to relieve the pain, but it does a little bit, you know, and that's what I care about. As long as it does a little bit, then I'm okay, you know what I mean? And that's what's important to me. And then number 3, which is, what did I say? Oh my God. I said tea, hot shower. Oh, the oil. So, guys, I literally been up since 6 a.m. But the hot oil is very important because, I mean, it doesn't have to be hot. I'm like procrastinating. It doesn't have to be hot, guys. Just any type of muscle oil. I use specifically, and I spoke about it before in my skincare, and I think I spoke about it in my migraines and headaches. I'm not sure. Like I said, I'm losing my mind a little bit, but that oil really does wonders, and I'll link it down below. It's amazing. I use it, and I'll put a little bit, and I rub it around the areas where I have the most pain, like my knees, my kneecap, my ankles, or my hands, or my back, or well, at least I try on my back, you know what I mean, because I only do it to myself, you know. So literally I rub that oil around everywhere, and it just works. It works for me temporarily, but it does a good job, you know. And I always rave about that product. I love the brand Elemis. I love all the products they make. They make amazing skincare as well. So I think that's just something that I love to, you know, listen and hear about. But because of that is the reason why I use the oil. And the thing that I love about that oil is that it's oily, but it doesn't stay on your skin as oil. Like, you know what I mean? Like, when you have like that oily like product and it's like greasy, like it's not greasy at all. It is just the oil base, and as long as you keep rubbing it and massaging, it'll go away, and it will not feel like any type of grease or oil, which is what I love about that LMS product. So I will link it down below for you guys. But besides that, those are all and only the 3 things that I do to kind of cope with chronic pain throughout my days. You know, otherwise, if it's really, really, really bad, take medication, guys. It's not worth your sanity, and it's not worth your day to go without, you know, to go with pain. Not without pain, with pain. We want to be without pain, but Take the medication if you need to. Don't just do what I do. This is what I do because I don't like to take the medication, but if I really have to and I'm at that point where I can't walk, I can't breathe, I can't stand, I'm gonna take medication, okay? So definitely don't oppose to that, but definitely try those 3 things out and see if it works for you guys. But besides that, thank you for staying throughout this entire video. I hope that I could have been as much informative as I can with you guys. If you ever have any more questions, ask me here, ask me on Instagram, ask me on TikTok, ask me on Snapchat, ask me wherever you can find me, and I will answer them for you personally, or whether you want it in a video, I'll do it in a video. Whatever you guys want, I will do it, because we need to advocate more for people who deal with these things, because this is all internal. You know, you can't see pain externally, not unless it's really that bad, but otherwise people who have invisible chronic pain, it's really hard. You know, and my heart goes out to all those people who go through that and still go throughout their day, because I can literally walk outside back and forth and it doesn't look like I'm in pain, but inside I'm in pain, you know, and it's real. It's invisible pain, but it's real. So really my heart goes out to people that go through that, because it's not easy. And I'll tell you that for myself. Hello, it's not easy at all. So I'm hoping that I can advocate for a lot of women, especially, that deal with that, because we are emotional creatures and we go through that, and it's hard enough to go through something like chronically, but we also emotionally have to deal with that, and it's not easy. So I hope that I can bring some insight for you guys. But anyways, without further ado, guys, if you haven't done so already, like this video and subscribe to my channel if you definitely want to hear a lot more. But besides that, without further ado, I will see you in my next video.